Hello, everyone. This is Dr. Carl Hansen. Today, and stick with me, this is going to be about the common cold. So there's tons of cold viruses going around right now, and a lot of people are contacting me with cough, congestion, sneezing, sore throat, etc. Some with a bit fever, but it's a common scenario. So I think we're going to cover it again, kind of a refresher course, if you will. And as always, this is not general medical advice, but is advice that I often give my patients, and this is supported by many other physicians in their practices and their observations. But as usual, contact your physician to find out what is right for you. And with that, we'll move on. So let's go over the fact that there are some treatments you can do contrary to previous opinion. And what we're going to cover here first is what is the common cold. The common cold is a virus, and it's typically in the category of rhinoviruses, coronaviruses, adenoviruses, and there's others. And for this discussion, I'm going to add influenza, although it's technically not a common cold. All right. The bacteria rarely is part of this, right? You don't really see that with the congestion, nasal blockage, sore throat, etc. That's not a characteristic of being caused by bacteria. So because of that, we really don't need antibiotics. Antibiotics are specifically for bacteria, and bacteria are not viruses. So that's important to know. However, there could be some exception to this long-standing rule as we speak. So, and there's another common misconception that I'd like to point out here, that if you catch the virus early, if you catch the cold early, so for example, somebody says, hey, Dr. Hansen, I've had a runny nose for 2-3 days. Could you send me in a Z-Pack because I want to catch this before it does something? There's no truth to that rumor. So you don't prevent it from turning into bronchitis. And typically a common cold doesn't turn into pneumonia anyway, but a common cold can turn into a bronchitis. Antibiotics do not change the course. As a matter of fact, antibiotics might actually aggravate the course by selecting for later a resistant bacteria. Now, the virus peaks in 4 to 5 days, and day 5 may be your worst day, maybe day 4 is, but then day to day after that, you start getting slowly better. So as long as you're turning that corner at day 4 and 5, then you're good. Now, another thing to point out is that you're contagious with the cold virus. Any of these viruses above that I mentioned. So it's the right before the symptoms start and then a few days thereafter that you're actually contagious with this particular virus. So you can spread it around. Now, there are situations that we suspect a bacterial infection may have jumped on. So if somebody's had a common cold that's lasting 3 weeks, that's not a common cold. A virus doesn't hang around for 3 weeks. So I listed some of the items here. These are the common ones that I use as criteria. Other doctors may use different criteria. And those criteria would be bloody nasal discharge. Again, if you have green snot, yellow snot, that's immaterial. Red snot is bad. If you've had a fever that's going on for more than 4 days, remember, I did say you could have a fever that lasts a few days. If it goes on day 5, that's clearly unusual for a virus. Intense facial sinus pain and pressure. If these maxillary sinuses are just screaming at you and they really hurt, that tends to argue towards a bacterial infection. Also, if you were getting better, but then you relapsed. So let's say you're 7 days in, you're actually a little bit better, but then day 8, all of a sudden things start getting worse again, more pain, more congestion. That could be a sign of a bacterial infection. And also, if the duration of the illness is greater than 10 days and you're not having any improvement at all, a cold virus would clearly be better at day 10 of the illness. And in fact, in many people, it's mostly gone. Just know that a common cold can drag on for a couple of weeks with slow improvement. So should we treat it? Nothing really helps the common cold. Don't like to advocate for antibiotics. By saying nothing helps, I'm referring to the over-the-counter decongestants, antihistamines. I think the only thing that I ever recommend is that people take some product with DM, dextromethorphan, if they happen to be having a cough. But otherwise, I don't think you're really looking at much of any benefit. So we'll go ahead and look at this a little more detail here. This is a cross-section. So here in the upper left inset beside me is the side of a person's head. And now we cut it in half. And you can see right in here, this is the nose and here's the mouth. So as you breathe in, air comes in through this big nasal passage and then goes down back over your soft palate, goes down back down into your windpipe. However, you can also, of course, breathe through your mouth. So if you open these lips, then you'll see that air can then go over the tongue down into the air passage. So this is the portal of entry for viruses. Makes intuitive sense to some that a mask that blocks the nose and the mouth would be of some benefit. That has never been shown to be true. A surgical mask is primarily to prevent a surgeon from spitting into your wound as they're removing your appendix. So it's not really that effective, and it's never been really shown to reduce anything. However, also like to point out, the eyes are not shown in here in this skull, but also the membranes of the eyes can be a place where viruses can get to and then go into the rest of your body. But anyway, the nasal cavity here, right, and the back called the pharynx, the oral cavity in here. This is where the virus actually obtains or attains its portal of entry. And that's an important thing to know. So if one virus makes its way and gets right here to part of the nasal cavity, it's not going to do anything. If two viruses makes their way in here, it's not going to do anything. It takes a heavy load of viruses for them to set up shop, anchor down, and actually start an illness going. So if you have 1 million viruses going into here, there's a good chance you're going to have a problem. If you have one virus going in here, there's very little chance you have a problem. So it seems like if we could somehow or another physically reduce the amount of viruses present in here, then that would be of some benefit. And that's what I'm going to talk about next. It's a spray, in essence, and a gargle that I would tell people to use. And let's cover that right now. First off is a mouthwash. Again, if you have viruses in your oral cavity, then you're going to find out that the viruses can multiply and they can become tons of viruses or millions. And also if in the nasal cavity. But let's cover the oral cavity first. Recommendation that I give to people, and this is also derivation of the FLCCC protocol, also corroborated by Dr. McCullough, a prominent physician in this COVID era, that you do mouthwash 3 times a day. So when do you do this? When do you actually do this mouthwash? My recommendation is that you do this mouthwash as soon as you feel that you're getting some sort of sore throat or something. I mean, if you're getting typical allergy symptoms like itchy eyes or sneezing and typical allergy stuff for you, then you don't have to treat it. But if you feel like you're coming down with something, then I would, let's say you go into a meeting or a party and there's just a room of coughing people just going crazy. And you're thinking, wow, this place is teeming with cold viruses. So that would be a time that when you get home, you go, well, I feel fine now, but I've just been around a ton of people who are spewing their breath all over the place. So I may want to treat myself. So let's go back and look at what you do to treat yourself, both in the oral cavity and in the nasal cavity, to try to wash out those viruses before they can gain a stronghold. So the mouthwash, you can use commercially available products over the counter. I'll give brand names here because this is also listed in FLCC's protocol: Scope, Act, Crest, etc. And they contain the above ingredients. I would also like to point out that this ingredient, chlorhexidine, which is found in these mouthwashes, is also the same stuff that the dentist gives you when they want you to wash your mouth out to kill bacteria. Peridex, and goes by a number of other names. So anyway, a mouthwash that contains any of those things, right? Now, also anything that contains thymol, such as Listerine, that's also been shown to reduce viral loads, to reduce illness after exposure to a virus. And another thing I would like to point out here, besides those brand name agents, is something called povidone iodine or betadine. Betadine is an agent that is used typically to clean wounds. So we'll have people that, let's say you're going to do surgery on or cut something out. Sometimes you'll scrub off the skin with alcohol. Sometimes you scrub it off with an iodine-related product, betadine. And it's a strong disinfectant, but it's also, in addition to disinfecting from a bacterial standpoint, also shown to be effective at reducing viral loads, and that's what we're interested in. This povidone iodine, now I got to say this, of course, some people are allergic to povidone iodine or iodine in general, and so those individuals should not, of course, take this product or use it. And if you're not sure and you want to just put a dab on your skin and make sure you don't break out, then you can do that, but do not use this if you're allergic to iodine. So we covered mouthwash, and as a quick interjection here, again, this is a mouthwash. This is something that you gargle in your mouth and then spit out. You do not gargle with these solutions and then swallow them. So this is a mouthwash that you then spit out, right? But we also, as you remember, we go back to the head here, you can see that there's a big nasal cavity where really most of these viruses go in. That's where you're shooting for it, right there, right? So the way you shoot for that is you're going to say, all right, what I'm going to do is I need to wash out my nasal cavity. So do I wash out my nasal cavity with Listerine? Well, no, you don't do that. Instead, what you wash it out with is Betadine. So the Betadine is done in this solution. You use it a few times a day. You do not use it if you're pregnant. If you usually find at the drugstore 10% solution of Betadine. That is too strong. You don't want to spray that in your nose. That will sting like the dickens. You want to have a 1% solution of the Betadine. That is going to be effective and is not going to burn you. So the way you do this, so how do I make this solution? Well, you take 25 milliliters of Betadine of the 10% solution. So you're using now the 10% solution, which you can buy at the drugstore. All right, it does not require a prescription. And then with that 10% solution, 25, then you use 250 of some other distilled water or something like that. And the way you do this, let me just show you how you do this, and I'll just show you the Betadine. So in general, this is the Betadine, the povidone iodine. So this product you can just get at any drugstore, or you can order it online, I'm sure. But you can see here that according to this, that it's a 10% topical solution. Well, that's how it comes, all right? And it is an orange, dark orange, opaque product. But you take that 10% solution. Again, do not. You can clean your skin prior to doing some sort of surgery with this if you're not allergic, but you do not actually gargle with this and you do not inhale this in your nose. This will burn. What you do is you can get a nasal bottle sprayer. Right. Now these, and I'll put the link below, but this, I just got this ordered off of Amazon. It is a glass bottle and it unscrews. What you would do, I like the glass better than the plastic because it's as tough. It's also darkened so that it's more stable in ultraviolet light. And also, it does not, if it's a plastic bottle, the plastics can be absorbed into whatever solution you're using. So you'll take this solution and you'll take the 10% povidone iodine and you'll fill this bottle to 1/10 of its total volume. So then what you do is you get some distilled water or water that you've boiled, etc., or sterile water, and you fill the remainder of this bottle all the way towards the top. So you only have a tenth is composed of the Betadine you put in. The other 9/10, if you will, is going to be the distilled water, the sterile water. Now, in doing so, I didn't make a precise 1-to-10 dilution, but you understand that you really want to dilute this about a factor of 10, that you do not want the full 10% povidone iodine solution. So once you've done that, then you've made your diluted product. Then you just put this cap back on and you're ready to roll. And there you take this off and there's your little pump sprayer that you would use to deliver this. And this, of course, would go into your nostril. So that's how you take the 10% over-the-counter or commonly available povidone iodine or Betadine, and you turn that 10% solution into roughly a 1% solution. And this is what you spray into your nose. And you would do that 2 or 3, no more than 4 times a day. You can also take the same 10% solution and make a separate container of it where you use a larger bottle, but with the same 1 to 10 dilution. And now that can be your gargle solution, but it's still the same degree of dilution. So again, what we do here is we make this solution of, this is the gargle size, right? 25 cc's with 250 cc's of the water. And in this thing, then you tilt your head back and you put drops in each nostril, or like I said, you use the sprayer. But you can also, as noted above, since you've made that 1 in 10 solution, you can also use it as your gargle agent, right? So you can make the big bottle of stuff and then pour that into the little spray bottle, or you can make the little spray bottle part separate. So there's been studies that shown that's actually reduced the amount of viral load, again, within this nasal cavity here. So the spray does that. Does it kill all the viruses? No, but remember, you don't have to kill all the viruses. Again, I mentioned if just a couple viri get into your nostrils, that's not going to cause any problem. If 1 million of them do, it is. If you can knock that 1 million down substantially, then you're likely to make a meaningful impact. Now, some other particular items about this early COVID and treatments, because remember, COVID virus, the coronavirus is just, again, as I mentioned before, a common coronavirus. It's just a common cold, and it's always been that until some criminals modified it and set it loose, and now it caused the illness because it was modified to be more violent in its attack on humans. But we can use a lot of the information we've obtained from this for all the other viruses. And I would also advocate for, during flu season, if you think you might be coming down with influenza, that you use these nasal hygiene methods. That's how influenza gains access to you. It's not through eating food. It's through inhalation, essentially, of aerosolized products. A couple other points I'd like to point out here to give credit for about treatment of these viruses is the protocol from the FLCCC. They were kind of partners, if you will, the forefront of treating COVID and not letting people just die of suffocation. Treating COVID early. And many of y'all know that I treated COVID early with many products, and I still do to this day, although it's not particularly as big of an issue. FLCCC puts out a publication which is very helpful and has a lot of resources. And I have it here on the screen, and I'll provide a link for it down below, but it does show, for example, the treatment for influenza and RSV. So why am I bringing influenza and RSV up? They're not part of the common cold. You could argue that RSV is, but I am not at this time recommending that individuals across the board get immunized against with influenza and the RSV vaccine. There's not enough data of safety, and some of the efficacy data, especially with the current flu virus vaccine, seems to be pretty poor. So because of that imbalance of data, I'm not recommending people get this. But instead, take a look at these products and look at some of the first things mentioned here also with them. For example, the nasal spray that we talked about. We also talked about the mouthwash. They go over some other things, vitamin C, and you can see nutritional components. In severe cases, you can see ivermectin and zinc. But anyway, I'll provide a link to this resource, and this can help a lot of people. But again, because I'm not really advocating for use of the influenza nor the RSV vaccine, at least as of December 2023. I hope that helps. I've been telling people I was going to tell them how to make this betadine or povidone iodine mix, and how to use it as both a gargle and also as then a nasal spray. That's the same thing. You're in a room, crowded people, a lot of coughing and sneezing, or one day you start feeling like you're coming down with something. Get the gargle ready and get the nasal sprays ready. And do that for about 5 days to reduce any viral load that's starting to develop in your nasal cavity. And I think you'll find that that'll significantly help you. And then you can use some of the other products if necessary just be nutritionally fit, eat healthy. All right, thanks for listening, and we'll catch up with you next time. Bye.